A new clinical practice guideline published in the Canadian Medical Association Journal is offering a fresh roadmap to help healthcare providers and families deliver better, more collaborative care for children and adolescents living with obesity. The guidelines stress the importance of evidence-based, fully informed treatment approaches, ones that include the patients and their families every step of the way. Among the recommendations, psychological support like behavioral counseling, strategies to improve nutrition and physical activity, and in some cases, the consideration of medications like GLP-1s, including brands such as Ozempic. While Dr. Sylvain Charlebois was with us, we asked him for his perspective on the announcement.
Well, I'm not a medical expert, but it was certainly a bit of a scratcher from a food industry perspective. As an academic, of course, you do wonder what is going on here. Are we sending the right message? And who's defining what a healthy lifestyle looks like, really? At the end of the day, of course, food manufacturers and the food industry overall prides itself in supplying Canadians with healthy, quality products. But the message that we're getting from the medical sector is that, well, food is a problem, so we have a pill or a vaccine for you. And I don't know, like with adults, that's fine. And we are expecting over 3 million Canadian adults to actually use a GLP-1 drug by 2030, which is a lot, but that excludes Canadians under the age of 18. And so if we are to start seeing more of younger folks using a GLP-1 drug, telling them that, well, you can basically use this for life, I'm not entirely convinced that the food industry will find some comfort in that kind of message, because there's obviously you have to think about beverages, you have to think about the healthy foods that are being marketed, and if you have a huge chunk of the market saying, well, I can basically eat anything and I still have access to some medication to deal with my weight. At the end of the day, I'm not exactly sure that's the society we want.
Earlier, we discussed the significance of these new guidelines with Dr. Abhishek Raut, medical director at Appletree Medical Group. Here's what he had to say.
Dr. Raut, thank you so much for joining me today.
Thanks so much.
Now, this is the first time the guideline has been updated since 2007. Why did it take so long to come out with a new guideline?
That's an excellent question. And I think it really touches on the heart of why medicine and clinical guidelines will evolve at a very deliberate and slower pace. So the idea is the update for something this massive or this clinical is going to be inherently rigorous, and it's going to be very methodological. So since 2007, we've seen this landscape of evidence change specifically around childhood obesity. What we're seeing is biological, psychosocial, and social dimensions all being part of obesity in children. And so because of that, this is one of those things that we do expect would take a long time. Also, what we're seeing now with our guidelines is more stakeholder engagement. So input from diverse voices isn't just beneficial, we're realizing it's necessary. And so that's why we want to have guidelines that are not only evidence-based, but are also compassionate and applicable to various contexts in Canada, but also globally.
And how much has childhood obesity changed since this last guideline came out in 2007?
I think what we're going to find is that childhood obesity has really dramatically increased in general. And so because of that, we've needed to change strategy. And this really represents a paradigm shift in how we manage pediatric obesity management. So previously, clinical approaches were very emphasized on targets and numbers and really had a one-size-fits-all strategy. But what we're seeing now is that because obesity is so complex, the emphasis is really looking at it as a chronic quality of life condition here. And because of that, it's a shared decision-making model where we look at multiple areas, including the psychosocial aspect of things as well. And we also look at options for medications like GLP-1 agonists, which we previously had not considered.
Now, the guideline highlights the need to ensure that families are fully informed and part of the decision-making process. How does this change the way doctors like yourself would approach obesity treatment in children?
I think that's a good question. I think before it was much more clinical, but now with these new guidelines, what we're recognizing is keeping families at the center of every decision instead of just dictating an approach there. Obesity, especially childhood obesity, is a very complex and multifactorial condition. And because of that, we do need that shared decision process. So these guidelines are now going to allow for a much more personalized and flexible approach, which will, of course, improve adherence to treatment plans, but it's also going to build trust and ultimately is going to support better long-term care management for the child.
And there's a strong focus on psychological support in this new report that's come out. Was there a shift in psychological support, or why is there a need now for there to be so much more increased support in this aspect?
You're right. So in the new guidelines, there's a strong emphasis on psychological support because now what we do understand is that pediatric obesity isn't just a matter of calories or exercise. It's a complex multifactorial condition. And there's part of the child's that's mental and emotional well-being that plays a part of this as well. So in this case, it's more recognizing the importance of that and recognizing the importance of behavioral and psychological interventions just from the start. And ultimately, what that means is it's going to be a multidisciplinary approach. It's going to involve mental health professionals, nutritionists, ideally physical therapists, and pediatricians as well.
Now, in regard to the mental health aspect with childhood obesity, how related are these two topics? Will children tend to struggle more with mental health if they are experiencing obesity as well?
Yes, what we do find is there's a very strong correlation. And at times, what we do see is obesity itself can lead to a negative self-image. All of this can lead to stress, anxiety, and even depression. So having these targeted approaches are very helpful because you are taking care of the child's mental health, but also of the obesity aspect and how they intertwine.
Now, you did mention that the guideline has introduced new GLP-1 use, which is Ozempic, or an example would be Ozempic, as an option to deal with more severe cases. Now, is there a worry that by prescribing children with Ozempic that are dealing with obesity, this is basically telling kids, don't worry, you don't have to exercise. You can go on Ozempic and almost lose weight the easy way?
You know, I hear what people do say about that, and there is a concern about it being an easy way out. You know, the way I look at it dealing with families is that this is a fighting chance. This is a way to really use comprehensive evidence-based strategy, and Ozempic or GLP-1 medications will play a role, but not the only role in combating childhood obesity. So what we are looking for is really an intervention that's behavioral, nutritional, psychosocial, and GLP-1 medications will play a role in that broad package as opposed to just the only role there.
And are there concerns that using Ozempic as a weight loss option as a child could trigger body dysmorphia or more eating disorders? You know, we did just talk about the fact that mental health issues in children who deal with obesity are higher. So by taking a drug at a young age before puberty and then hitting the point where you tend to care more about what people think of you, could that impact eating disorders and, like I mentioned, body dysmorphia?
I mean, there's always that risk in place. I think that's a very valid concern. And really, it comes to the heart of having a careful evidence-based approach. It's important to note with GLP-1 medications like Ozempic, they're not inherently addictive in the traditional sense. They don't trigger any euphoric effects or a specific dependency there, but they do regulate appetite and blood sugar levels. But yes, it is a concern that we do have, and we really have to be vigilant to look for any pharmacological intervention or unintentional influence regarding eating behaviors that could certainly play a role in it as well.
And what roles would schools and communities play in supporting these kinds of lifestyle changes according to the new roadmap that has been published?
I think what we are going to see is that the entire community, including schools, are going to play a role here. When we look at childhood obesity in Canada, it has changed considerably. It's risen essentially 1/4 of children aged 4 to 11 now, and 1/3 of adolescents aged 12 to 17 have a BMI that puts them in the overweight or obese category. So that's a substantial increase that we're seeing. And it's not just Canada, we're seeing it throughout the world as well. So that means it's not going to be just a role for the psychosocial or just a role for the physician, but I think it's going to be something that we do have to address with schools as well.
Now, you've mentioned this increase in obesity that we're seeing not only in Canada, but worldwide. Are there certain factors that are triggering this increased rate of obesity?
I think it's been very difficult to really track down what this has been. We do know it's not simply just a calories in, calories out approach to see this drastic increase in changes. We know that certainly lifestyle changes have played a role in it as well. We know that the pandemic certainly has played a big role in this issue as well. So we're seeing this mirrored in multiple countries. And what we do need to see is an approach that's going to target all of those things that went wrong in the past 10 to 15 years and really bring a lot of changes so that society itself can look at obesity in a different light, but also end up decreasing the overweight and obese category and bringing people more back to a healthy BMI.